This is the 10th video in the Ethics and Legal Considerations in Animal Chiropractic. In this video, I want to talk very briefly about responding to mistakes in a way that minimizes your risk of liability or complaints. Most of this is common sense, and I expect that most of this is something you've already been taught or have already figured out based on common sense, but never hurts to be reminded. So some of the things to focus on. First thing is take care of the patient. If the patient can be treated, please focus on taking care of the patient first. Um, Once the patient is in a stable situation or in the best possible situation, then you need to compose yourself. You need to investigate and try to decide what happened. Now, you can't take 2 weeks. You can't spend a lot of time trying to figure it out, but you can try to, you hopefully have been supervising or involved enough to know a little bit about what was going on and can try to figure out what went wrong that caused a bad result. And the next thing you need to do is you need to make a disclosure to your client. Client is likely to have questions. You want to be able to answer those questions as completely as you can and as accurately as you can. Explain what happened as best as you can. And you know what? If a mistake happened, make an appropriate apology. Um, if you're concerned about your malpractice insurance, you may contact your malpractice insurance carrier directly. And I think most, if not all of them, have had the same experience that sometimes, as long as somebody says, "We are sorry, we made a mistake," no, there is no lawsuit, there is no claim, there is no complaint to the state board. And because the insurance companies have figured out, they generally will allow you to make a acknowledgement that a mistake occurred and to make an appropriate apology for that mistake. Now, if there's some question or if there wasn't a mistake, if this is just a bad result, just because bad results happen, then they're certainly going to direct you to not admit that there was a mistake because it wasn't. But certainly an appropriate apology may include anything from, I'm sorry this happened to you and to your pet, um, which doesn't give them much of an assurance that you are accepting responsibility. I'm sorry that this mistake happened, or even better than that, I'm sorry that I or my team made this mistake. If there was a mistake, taking personal responsibility for it is usually the best practice. Now, again, if you're concerned about malpractice insurance and you haven't been advised from your malpractice insurance company, take a minute to get them on the telephone, get their claims adjusters on their telephone, and see if they will allow you to make that kind of mistake, kind of statement. Next thing to do is in talking to your client is to discuss the plan of care for the patient. Is there, if the patient's deceased, then that's one thing, but if the patient is injured and can still be treated, what is the plan of care? What do you plan to do? Be accountable. Mistakes happen. I think people understand that mistakes happen. And if you accept responsibility and you are sympathetic or you are apologetic about it and um, show a appropriate level of sympathy, you're less likely to cause the client to be upset about it or upset towards you. You may also, depending on the circumstances, discuss how you're going to prevent this from happening in the future. What are some things you can do in your office, or what do you think you should do in your office? Now, this may not be the conversation immediately after the patient is injured, but that may be something you want to share with your client down the road to let them know that this was truly a one-off and you learned from this mistake. It's not something that you are ignoring or not conscious of. Just kind of a few guidelines for making this kind of disclosure. Choose a quiet place. Clinics can have some very busy, very noisy areas. You want to try to find the quietest place possible. Perhaps that's an office setting. Um, You want to minimize any distractions. Turn your cell phone off, not on silent. Turn it off. Don't check your messages while this is occurring. Notify your staff that you need to share some difficult news with your client and you need to have some private time to talk to them and that you should not be disturbed unless it's truly an emergency that requires your intervention. Certainly, the client has probably figured out when you invite them back into an office or a meeting room space that this is not a good situation, but give them a warning anyway, a verbal warning that you have difficult news, and then again, be as direct as possible. Pay attention to nonverbal messages. Make eye contact. Um, do not sit and look down at your notes. Don't sit and look down at your phone. Don't try to look over the top of the client's head. Make eye contact. That can be very difficult to do sometimes, particularly if you're not used to making eye contact when you're talking to people, but that can be very important in communicating effectively. Sit at the client's level. Um, if there are high stools and low stools, make sure you're sitting on a stool that's the same level as the client. Don't be in a situation where you're sitting above or standing above them. You want to be sitting and talking as peer to peer, not as doctor superior to client inferior. Respond to nonverbal cues. If the client is upset and they need a moment, give them a moment. If you need to ask if they need a moment, ask if they need a moment. Um, Certainly, if the patient is deceased, you want to give them an opportunity to see the patient if appropriate. Um, you want to facilitate discussion and questions. Now, when you share bad news initially, there may not be an opportunity for the client to think of questions that they may have, but you want to make it clear that you're available if they have questions in the future and make plans for your next contact with the client. Follow up with them in a few days to see how they're doing, to see how the animal is doing, um, and to maybe answer any questions that they have thought of in the meantime. So this is all just general, to me, again, common sense, good common uh, people skills. But too often when I read malpractice cases, I see that doctors didn't follow these fairly simple steps. They don't accept responsibility. They pretend they didn't make mistakes. They're immune from mistakes. They don't communicate the information in a environment that's appropriate, and it sends the wrong message. It does not communicate effectively to the client that you care about what went wrong. And you should, and I hope you care about what went wrong. Now, I also hope you never have to worry about making this kind of disclosure, but I also know that if you practice for any length of time, you will have situations where you have to share difficult news with clients. And you need to be ready or think about what's your process going to be if and when that happens.